Hello, everyone. I am absolutely thrilled to be here this evening. And today I would like to talk to you about, can I get pregnant with heavy periods? So this is a really important topic, and I want to discuss it with you tonight because there is implications towards having a heavy period, and I just want to discuss what that means for your hormones and your fertility when that's the case. And also what it means if you do happen to get pregnant as well, what sort of factors to consider there too. If you have any questions as we go through, be sure to pop them in the comments box if you're on Instagram or Facebook, and I'll answer them for you. If you're watching this after the live, I'll go back and answer those questions for you as well. So let's get started. So I'd like you to remember that even though we're talking about fertility today and getting pregnant, fertility isn't just about having a baby. So, fertility means that your body is in the best possible shape and your hormones and your reproductive system are in the best possible health so that it supports your emotional health, mental health. It means that you have sort of nice, easy periods that aren't irregular, sort of pain free or minimal pain ideally. So it just means that you have a healthier experience throughout your menstrual cycles as well. Because at the end of the day, a healthy body is a fertile body. So I know people often associate that word fertility with getting pregnant, but it's actually all about having hormone balance and what that means for you in terms of your menstrual cycles and emotional health. So, you're probably wondering, so can I actually get pregnant with heavy periods? Let's discuss that. So the thing is, okay, so it may be a possibility, right? So, but what does that actually mean in terms of trying to conceive? It will mean that potentially, okay, it might happen, or it might be quite challenging for you. And we'll discuss those reasons why as well. And that at the end of the day, the heavy bleeding has implications in terms of your infertility and being able to conceive as well. So that is something to consider too. Also, really, I wouldn't actually recommend trying to conceive until you actually manage that heavy bleeding. It's extremely important because with the heavy bleeding, there is risks involved. So it's definitely not risk-free to go in with heavy bleeding and try and conceive. You need to actually address that prior to conceiving. That's very important. So, what is considered a heavy period? Often this is something that a lot of my patients get confused about when they come into clinic, and it's no wonder really because we don't really compare. We might say to our friends around us, I have my period at the moment, etc. But we don't sort of compare notes and say, how much blood did you lose? Or how many pads did you go through today? So we don't really have an understanding of what a heavy period is actually determined as. So a heavy period is when you're bleeding more than 7 days. So it could be any one of these factors. It could be having to change your pad or tampon every hour, but not because of hygiene reasons, because it's actually saturated, so it's kind of overspilling into the pad or on the tampon. Losing more than 80 mils of blood. So that one's a little bit difficult when you're wearing pads and tampons to determine the volume, but you just get an idea that, it's fully soaked. But if you're using a period cup, for instance, that has the mils on the side of it, so you can often determine how much mils that you're losing, and that 80 mils sort of correlates with the whole period. So over the duration of the whole period, if you're losing more than 80 mils, that's considered heavy. Blood leaking through into your clothing or on the bed sheets. So that's another sign that it's extremely heavy. As I discussed earlier about flooding into the tampon and pads, so that's another way you can tell. So you might be using the super pads or tampons, for example, and they're completely soaking through. It's more those kind of larger size. Having to change your pad overnight or your tampon, having to wear a pad and a tampon. And there is a lot of my patients that double up in terms of that because the period is so heavy. The need to pop a towel down, so when you go to bed, actually putting a towel down underneath you because you're worried about it getting on the sheets. That's another indication too. Clots that are greater than a 50-cent coin. So this doesn't always determine sort of heavy bleeding, in my opinion. I think it's more the other factors that you need to consider. And it's easy to get all attitude about, your period being heavy. Oh, why is it doing this to me? Why is my body doing this? But you can't shoot the messenger. At the end of the day, your body's trying to tell you something. Something's not quite right. So the only way it can present that to you is by doing that. So it's just kind of, popping a little red flag up and saying, hey, something's not quite right here. So why would I have heavy periods? Well, there's lots and lots of different reasons, so I'll just mention some of them. It's not extensive by any means. There's a lot more reasons as well. So it could be due to PCOS, so polycystic ovarian syndrome. So basically it's a syndrome with a collection of symptoms, and generally to be diagnosed with this, you usually have to have 2 out of 3 of these things. So you might have polycystic ovaries or you might not. As I said, it's 2 out of 3. You've got signs of too much androgens, so things like testosterone. And that might be showing up in blood work, or it could be sort of signs and symptoms of that. And the third one is, sorry, I've just gone blank. When you're kind of on a bit of a roll and a rant and you forget what you're saying. Irregular or no periods, so that's the last one as well. Endometriosis, that's another one as well. So that's basically an autoimmune type condition where the endometrial tissue is actually growing in a place other than the uterus. So it's causing a lot of inflammation there. Another one is fibroids. So they're basically benign growths. So benign is just a fancy word for non-cancerous. Now these can grow within the muscular wall of the uterus, or they can actually protrude out into the uterus. So there's different types. There's about 4 different types of fibroids. Hormone imbalance. So this is such a common one. So estrogen and progesterone do a dance throughout your menstrual cycle, and it's important that it's actually in balance, because if you have excess estrogen, for example, that's going to cause the endometrial lining to thicken too much, so that can lead to heavy periods as well, because as we know with our menstrual cycle, when we have our period, when it will be that lining that's being shed. So if it's thicker, obviously that means there's going to be more blood flow. Another reason could be polyps. So polyps are benign growths. Again, seems to be a lot of these, and these protrude into the uterine cavity as well. Now, another reason can be adenomyosis. So that's another one where tissue similar to the endometrial lining is actually inside the uterine wall. So it's kind of in the wrong area there. So that can cause heavy bleeding or heavy periods as well. Now, long-term intrauterine device use can also contribute to that, interestingly enough. it's interesting actually because that's used in the management of that as well. So it kind of leads to that in the end as well. That's with long-term use. And that's more the one that produces the synthetic progestin. So like a synthetic form of progesterone. Another one, which is a really common one that I see, is thyroid dysfunction. So hypothyroidism, which is more of an underactive thyroid, that can also lead to heavy periods too. Now, the medical approach is usually they'll give you an oral contraceptive of some sort, so Primalut. Another one is Micronel, that's a combined oral contraceptive pill, or the intrauterine device. So that could be a Mirena, and it's more the synthetic one that produces the synthetic form of progestins or progesterone. So that's usually the management. But normally, it's addressing the leaky tap issue. So it's essentially helping with that. It's trying to turn off the tap. And more often than not, it helps to a degree. Sometimes it doesn't help completely, and I have had patients where they're still bleeding really heavily, and it just hasn't resolved because you're actually not sort of addressing the factors that are contributing to those heavy periods. It's simply just turning off the tap. So we need to understand why that's happening for you and actually address that. So it's more like a band-aid solution. So why wouldn't you try to conceive if you've got heavy bleeding? So there's a few reasons for that. And basically some of the reasons are, so there could be iron deficiency. As a result of that, you're bleeding very heavily, you lose a lot of iron. And actually if you have low iron or anemia, that can actually lead to more heavy bleeding too, so it's sort of a cause and effect thing there. Now, we need to remember that iron is extremely important. It actually delivers oxygen and nutrients to the uterus and the ovaries, so they need it to function properly. So as a result, how are your ovaries and uterus meant to function normally without sort of enough iron present? And anemia can cause anovulation, which means that ovulation doesn't occur. And that's because your ovaries just can't work properly, and as a result, it leads to issues with egg development, maturation, etc. And it's just not going to happen. Ovulation won't happen. It leads to poor egg quality as well, because as you can imagine, you need that oxygenation and nutrient delivery to your follicles to be able to mature and develop. If that's not provided, they won't be able to be of good quality, will they? Because they're not sort of developing properly. Now, it's very important to remember that once you hit pregnancy, it is very, very hard to actually address iron deficiency, because there's such a demand during pregnancy on your iron stores. The baby needs it for growth and development, etc. And so basically it's just going to be really, really hard to actually top that up during pregnancy. So it's best to actually address iron deficiency before you start trying to conceive, just to make sure that then there are no risks to yourself and the bub, because there are plenty. So these are some of the risks. So postpartum hemorrhage, so a lot of blood loss, after birth can happen, which is really concerning. Postpartum depression is another one as well. Miscarriage is another one as well. Preterm birth, so the baby's born too early. Fetal growth restriction, because as I said, the baby needs iron to develop properly and mature. A low birth weight baby is another issue as well. Poor brain development. and poor placental development. So these are really, really serious. So can you see how it's a flow and effect? If you actually don't address this before you start trying to conceive, it's going to pose very many risks in terms of your experience during pregnancy and also to the bub to be as well. So very concerning. And even in terms of, trying to get pregnant, obviously it's going to make it more challenging for you as well. But not only do we want to increase the chances of a successful conception, of course, but we want to actually experience a healthy pregnancy, a healthy labor, a healthy birth, and a healthy baby, don't we? We want all of those things. Now, another issue, as I mentioned, could be hypothyroidism, so an underactive thyroid. And I see this quite a lot in clinic, and it impacts your fertility. Remembering that a TSH over 2.5 can more than double the risk of having a miscarriage. And this is considered subclinical hypothyroidism. So it means that you're not in overt hypothyroidism. So it's not, full-blown hypothyroidism, but it's getting there. So it's still concerning to have a TSH over 2.5. It impacts fertilization rates. So that's concerning, isn't it? Because if fertilization doesn't take place, there won't be a baby to be. It impacts embryo quality as well, and live birth rate, so whether actually that takes place or not. It impacts ovulation. It's important to remember that the ovaries need an abundance of iodine to actually function properly, so it makes sense that it impacts ovulation too. During pregnancy, there are plenty of risks as well if you're hypothyroidism going into pregnancy. Not good. So fetal death can be one of them, which is so drastic, isn't it? Awful. Premature delivery is another one, so the baby is delivered too early. Spontaneous abortion is another one as well. And it impairs brain development. It's important to remember that a healthy thyroid is extremely important for your baby's brain development as well. So don't forget that. Now, another factor to consider in terms of this heavy bleeding is hormone balance. Extremely, extremely important. So hormone imbalance is all about when your body produces too much or too little of certain hormones. There is a bit more to it than that, but that's sort of a simplified explanation. And symptoms and signs of hormone imbalance can be so many different things. So it could be irregular periods, painful periods, periods that are too long. It could be menstrual cycles that are too long or short. It could be PMS. It could be sore boobs, etc. Mood swings. All those kind of things can indicate hormone imbalance. And that's not extensive either. There's heaps and heaps of different symptoms and signs of hormone imbalance. Now, let's not forget when your hormones are imbalanced, that's going to impact your fertility as well. So regardless of whether you're trying to conceive naturally or through IVF, it's important to have those hormones balanced, isn't it? And because that's a factor that's contributing to heavy bleeding, that obviously needs to be corrected as well. So the way that hormone imbalance impacts fertility is that it impacts ovulation. So whether or not it takes place, whether it's delayed, and how will you know when your fertile window is? If you're not ovulating or it's delayed, it's going to make it very, very hard for you to determine that, so that you know when to actually actively try and conceive. Now, low progesterone can be an issue as well. that actually prepares the endometrial lining for the embryo to implant. So that's very important. Obviously, estrogen is important too because that's all about building the endometrial lining. And as I think I already mentioned, if we have too much estrogen, that can actually make the endometrial lining too thick, and that's not good either. Think of progesterone kind of like a interior designer to the endometrial lining, so it's making it seem more attractive to the embryo. Now, high prolactin can be an issue as well. So this can be produced when you're quite stressed. So if you're really stressed, you produce a lot of prolactin, and this will actually delay or stop ovulation as well. So that can be another contributing factor. Now, we talked about high estrogen, so that can impact whether implantation happens as well, and it can actually affect that. Low estrogen is an issue, so it can lead to poor follicle growth. It prevents LH secretion, which happens around ovulation. Remember, LH sort of triggers that response of ovulation taking place, and that doesn't happen if estrogen's too low. So we can see how estrogen and progesterone are both equally important when it comes to conceiving, and they need to be in a proper and adequate balance. Irregular cycles is another thing that results as well if your hormones are imbalanced. So that's going to make it hard as well, isn't it? It's sort of like, oh, when's my period coming? Is ovulation happening? Is it delayed? When's my fertile window? It's all going to be very hard to determine those things. So we have to assume that all of those conditions that I spoke about earlier, they are all conditions of hormone imbalance, okay? And a lot of them have estrogen as a driver. So things like PCOS, endometriosis, fibroids, adenomyosis, all have estrogen or kind of too much estrogen as a factor that's driving that condition. So whether it be sort of actual estrogen dominance, so it is too much, there's too much there, or whether it be relative to progesterone, estrogen is too much. But essentially, either way, generally there'll be a progesterone deficiency. So see how there has to be a nice healthy balance there. Now, so those are all the things to consider. So can you see why it's extremely important to actually address heavy periods before you actually start trying to conceive? Because not only is it going to affect your ability to be able to conceive because of all those factors I spoke about today, but the implications of that, so if those factors aren't addressed, is pretty brutal, during pregnancy, and what it means for your baby to be, what it means for your labor, your birth, and your postnatal experience. So we really need to address that. It's absolutely essential. I'm sure you'll agree after what we spoke about today. You can really, really see the importance of addressing the primary cause or causative factors, so determining why it's actually happening. And that's the kind of thing that I help with. So as a hormone and fertility naturopath, I'm sort of going in like a detective and trying to find out why you are actually experiencing heavy bleeding and actually address those factors, because they will be impacting your fertility and ability to become pregnant. So extremely important stuff. So if this is you and you're experiencing heavy bleeding, whether you're trying to conceive or not, this is something that I see in my clinic a lot, and I would absolutely love to help you. So if you would like to know more, I would encourage you to book a free discovery call for 15 minutes to talk about how we would be working together and whether we're a good fit. So I'll actually pop a link below for you if you are looking towards doing that. And basically, yeah, if you have any questions at all, just pop them in the comments box. As I mentioned, I'll go on after the live and answer those for you. And it has been an absolute pleasure talking to you this evening. I've thoroughly enjoyed it, and I hope that you have too. I'm on every week on Instagram and Facebook live on Wednesday night at 7:30, talking about something hormone and fertility related. So I hope to see you next week. If you're watching on my YouTube channel, be sure to like and subscribe, and I will see you next week. Thank you so much. Bye.